Well, Diversion First is a county initiative to reduce the number of people with mental illness in our jails by diverting them into treatment as opposed to incarcerating them. First is Crisis Intervention Team Training, CIT we call it, and that's a 40-hour course that is ongoing that trains police officers with the skills they need to de-escalate a situation involving persons with mental illness who are experiencing a mental health crisis. The second aspect is a crisis assessment site in the new Merrifield Center. And the crisis assessment site is a secure location where a police officer can bring a nonviolent offender and transfer custody of that person to a CIT trained officer who is stationed in the facility. The original police officer can then return to his or her patrol duties, and the person then is entered into treatment. And then over 3 to 5 years beyond that, we're planning to expand our services both in terms of capacity and the variety of mental health and diversion services available. Well, there are numerous stakeholders. They come from areas such as law enforcement, the judiciary, human services, public and private healthcare entities, advocacy groups, and many, many more.